Myocarditis and pericarditis is defined as inflammation of the heart muscle. Myocarditis affects your heart's electrical system, leading to irregular heart rhythms and problems with your heart's pumping function. In severe cases, myocarditis may lead to stroke, heart attack, and heart failure, or even death. Recently, myocarditis is trending on Twitter. Today, I will dive into the question, does COVID infection and/or the COVID vaccination cause myocarditis? So before we begin, please pause and read this medical disclaimer shown on the screen now. So let's get into this. A nationwide study on the incidence and outcomes of COVID-19 vaccination-related myocarditis, or VRM, was published in the European Heart Journal. Among over 44 million individuals with at least one dose of COVID-19 vaccination, the incidence and clinical causes of vaccination-related myocarditis, or VRM, cases confirmed by the Korea Disease Control and Prevention Agency were analysed. COVID-19 VRM was confirmed in 480 cases. That's 1.08 cases per 100,000 persons. Vaccination-related myocarditis incidence was significantly higher in men than in women. That's 1.35 versus 0.82 per 100,000 persons, and in mRNA vaccines than in other vaccines, which was 1.46 versus 0.14 per 100,000 persons on average. Alarmingly, vaccination-related myocarditis, or VRM, incidence was highest in males between the ages of 12 and 17 years, and that was at 5.29 cases per 100,000 persons or individuals on average. Severe VRM was identified in 95 of the 480 COVID-19 VRM cases. 85 of these had intensive care unit admission, 21 were deaths. 8 out of the 21 deaths were sudden cardiac death, or SCD, attributable to VRM proved by an autopsy, and all cases of SCD attributable to VRM were aged under 45 years and received mRNA vaccines. The study concluded that although COVID-19 VRM was rare and showed relatively favourable clinical courses in the study, severe VRM was found in 95 of the 480 VRM cases. Moreover, SCD should be closely monitored as a potentially fatal complication of COVID-19 vaccination. In another study, it was reported that excess events, which include myocarditis and pericarditis, within 28 days in males aged 16 to 24 were 5.55 events per 100,000 vaccinees, i.e. people taking the vaccine after the second dose with the Pfizer-BioNTech vaccine, and 18.39 events per 100,000 vaccinees after the second dose with the Moderna vaccine. The study concluded that the risk of myocarditis was higher within 28 days of vaccination with both Pfizer-BioNTech and Moderna vaccine compared with being unvaccinated, and higher after the second dose of the vaccine than the first dose. It was also stated that in this study, the risk of myocarditis associated with vaccination against SARS-CoV-2 must be balanced against the benefits of these vaccines. Now, here is where it gets fascinating. In a different study, which was published in March 2022, involving over 190,000 adults who were assessed after COVID-19 infection, the researchers concluded that they did not observe an increased incidence of neither pericarditis or myocarditis in adult patients recovering from COVID-19 infection. However, an English study including 42 million participants summarised that the risk of hospital admission or death from myocarditis is greater after SARS-CoV-2 infection than COVID-19 vaccination, and remained modest after sequential doses including a booster dose of Pfizer-BioNTech mRNA vaccine. However, the risk of myocarditis after vaccination is higher in younger men, particularly after a second dose of the Moderna vaccine. Overall, guys, there seems to be a lot of contradictory data out there regarding COVID-19 vaccinations and myocarditis. However, one thing is clear, and that is that younger men seem to have a higher risk of developing myocarditis from the COVID-19 vaccination than any other subpopulation. Before I close the video, please pause and read this medical disclaimer shown on the screen now. As always, please like and subscribe for more videos like this.